Hello, and welcome. As we get older, we're often told that more health checkups are always better. But what if I told you that for those over 70, some common tests might actually cause more problems than they solve? It sounds counterintuitive, but it's true. Overtesting can lead to a cascade of anxiety, unnecessary procedures, and treatments that don't actually improve your quality of life. Today, we're going to discuss 7 health checkups that seniors should approach with caution. We'll explore why more isn't always better when it comes to medical screening, the risks of overdiagnoses, and smarter, safer ways to stay on top of your health. This isn't about ignoring your doctor. It's about having informed conversations and making the best decisions for your well-being. So, let's get started. First on our list is routine PSA testing for prostate cancer. For decades, men have been encouraged to get their PSA, or prostate-specific antigen, LEB, checked. While this test can detect prostate cancer early, its benefits for men over 70 or those with a life expectancy of less than 10 years are highly questionable. Why? Many prostate cancers are slow-growing and may never cause any symptoms or problems in a person's lifetime. The U.S. Preventive Services Task Force recommends against routine PSA screening for men 70 and older. The risk of overdiagnosis is significant. Finding a slow-growing cancer can lead to aggressive treatments like surgery or radiation, which carry their own serious side effects, such as incontinence and erectile dysfunction. These complications can drastically reduce your quality of life, often for a cancer that might never have harmed you. Instead of automatic screening, have a discussion with your doctor about your personal risk factors and overall health. A shared decision is key. Next up, let's talk about routine mammograms for breast cancer screening in women over 75. Like PSA tests, mammograms have been a cornerstone of preventive health for women. However, as women age, the evidence supporting routine screening becomes less clear. Major health organizations have different guidelines, but many suggest that for women over 75, the decision to continue mammograms should be an individual one. The potential harms include false positives, which can lead to anxiety and unnecessary biopsies. Additionally, finding slow-growing cancers might lead to treatments that don't extend life, but can cause significant side effects. The focus should shift from routine screening to a personalized approach. Consider your overall health, life expectancy, and personal values. If you are in excellent health and would opt for treatment if cancer were found, continuing might be right for you. But for many, the risks of screening may start to outweigh the benefits. The third checkup to reconsider is a routine colonoscopy for colorectal cancer screening after age 75. Colonoscopies are fantastic for finding and removing precancerous polyps. For average-risk adults, screening is recommended from age 45 up to 75, but after 75, the recommendation changes. For individuals between 76 and 85, the decision should be based on their health status and prior screening history. If you've had consistently negative colonoscopies your whole life, the chance of developing a new, aggressive cancer is low. Furthermore, the procedure itself carries risks, especially for older adults. Complications like bleeding, perforation of the colon, and risks associated with sedation become more significant with age. For most individuals over 85, screening is generally not recommended at all. Instead of automatically scheduling that next colonoscopy, talk with your doctor about whether the potential benefit is worth the risk for your specific situation. Number 4 on our list is screening for high cholesterol or hyperlipidemia in adults over 75 who have no history of heart disease. Statins are medications used to lower cholesterol and are incredibly effective for preventing heart attacks and strokes in at-risk individuals. However, for older adults who have never had cardiovascular issues, the benefit of starting a statin for the first time is less certain. There is limited research on the benefits of statins for primary prevention in the very elderly. Plus, these drugs can have side effects, including muscle pain, digestive issues, and in rare cases, more serious complications. This can impact daily function and overall quality of life. Rather than focusing solely on a cholesterol number, a more holistic approach is better. Managing blood pressure, staying active, eating a healthy diet, and not smoking are often more impactful ways to protect your heart health in your later years. Coming in at number 5 is routine bone density screening, or DAXA scans. for women over 65 and men over 70 who have already been diagnosed with osteoporosis and are on treatment. If you've already been diagnosed and are stable on your medication, repeating the DEXA scan every 1 or 2 years is often unnecessary. The changes in bone density are typically very slow, and the results of a repeat scan rarely lead to a change in your treatment plan. It can create needless anxiety if the numbers fluctuate slightly. A better approach is to focus on what truly prevents fractures. Taking your medication as prescribed, getting enough calcium and vitamin D, and, most importantly, working on fall prevention. Strength and balance exercises are your best friends here. You should still have regular check-ins with your doctor, but you may not need the scan itself as frequently. The sixth test to question is the routine Pap smear for cervical cancer in women over 65. The guidelines on this are quite clear. If you are over 65 and have had a history of regular, normal Pap smears, and you are not at high risk for cervical cancer, you can stop screening. For example, if you've had 3 negative Pap tests in a row or 2 negative HPV tests in a row within the last 10 years, with the most recent test performed within the last 5 years, you're good to go. The reason is that cervical cancer is typically caused by the HPV virus, and it usually develops very slowly over many years. If you've had a lifetime of negative tests, your risk of developing cervical cancer later in life is extremely low. Continuing to test can lead to unnecessary procedures and worry. Celebrate this milestone in your health journey and focus your attention on other health priorities. Finally, number 7. Routine full panel blood tests at every single checkup without a specific reason. It is common to go for an annual physical and have a dozen vials of blood drawn to check everything. But for older adults, this shotgun approach can do more harm than good. Minor, clinically insignificant abnormalities can pop up, leading to a cascade of follow-up tests, specialist visits, and a great deal of worry. For example, a slightly low sodium level might just be due to what you drank that morning, but it could trigger a whole series of expensive and stressful investigations. A better strategy is targeted testing. If you have specific symptoms, or if your doctor is monitoring a known condition like diabetes or kidney disease, then testing is crucial. But for a general checkup, discuss with your doctor which specific tests are truly necessary based on your health and symptoms, rather than ordering a broad panel just in case. So, what's the big takeaway from all this? It's not about avoiding your doctor and neglecting your health. It's about becoming a more empowered and informed patient. The best approach to healthcare in your 70s and beyond is personalized and collaborative. Ask questions like, how will the result of this test change my treatment? What are the risks of the test itself? And what happens if we just watch and wait? Focus on the pillars of healthy aging: a balanced diet, regular physical activity, social engagement, and good sleep. Proactively manage chronic conditions you already have. And most importantly, build a strong relationship with a healthcare provider you trust. One who sees you as a whole person, not just a set of numbers on a lab report. Thank you for joining me today to explore this important topic. I hope this information helps you have more productive conversations about your health. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and share it with others who might benefit. We'd love to hear your thoughts or questions in the comments below. Stay safe, stay informed, and be well.